Pregnancy can be wonderful and blissful, but it can turn to worry very quickly. When my wife Carrie was pregnant with our twin daughters, she was automatically considered high risk, and due to this high risk, she was sent to a fetal medicine specialist in Greenville. Our 28-week visit consisted of an ultrasound tech finding an issue with twin A's umbilical cord. The fetal medicine specialist referred to this issue as a Velamentous cord insertion. The Velamentous cord insertion is at great risk of rupture during natural delivery, and due to this, the fetal medicine specialist recommended a cesarean delivery. Naturally, we had questions as parents. How will this affect our daughter? And as people, we also wondered what could we have done differently to prevent this. As parents, we also had general questions, much as you may have right now. What is a Velamentous cord insertion? What risks are associated with it? And how often does it occur in pregnancies? As parents, as many of you are, you may be wondering, what is a Velamentous cord insertion? It can happen in any pregnancy. According to Ultrasound Obstetric Gynecology written by Haskwa and others, a Velamentous cord insertion is an abnormal cord insertion in which the umbilical vessels diverge as they traverse between the amnion and the chorion before reaching the placenta. In other words, the umbilical cord has many vessels that plugs into the side of the placenta. In a Velamentous cord insertion, those vessels separate themselves, run down the membrane of the amnion and into the placenta, much like a spider web. The abnormality exposes the umbilical cord vessels to prolonged abnormal stress while in utero. The normal cord insertion at the base is 1.5 to 2 inches in diameter. The umbilical cord of a Velamentous insertion is roughly half that size. Being small in size, it also is unprotected with Wharton's jelly. Wharton's jelly is a substance that creates a sheath in a normal umbilical cord insertion. Due to the fact that the umbilical vessels run along the membrane of the amniotic sac, this prevents the Wharton's jelly from forming around the base of the umbilical cord. The absence and reduced presence of the Wharton's jelly and improper cord insertion bring many risk factors. Number one, the very limited protection of the umbilical cord during pregnancy. And risk to the baby while in utero may consist of the small umbilical cord, which allow low nutrient flow and low birth weight. Placement of the umbilical cord can also bring issues when the fetus may be sitting on top of those vessels, creating reduced flow of blood. Another risk concerned with a Velamentous cord insertion is also termed as vesiprivia. Medterms.com defines vesiprivia as a condition in which the blood vessels within the placenta or the umbilical cord are trapped between the baby and the opening of the birth canal. This may cause issue during natural birth and may cause rupture upon birth. Vesiprivia.org says that studies found that 6% of pregnancies with a Velamentous insertion, vesiprivia, is a coexisting condition. Obstetrics and Gynecology by Hanowen and others says that a Velamentous cord insertion is significantly increased among those 35 and older. You may say a Velamentous cord insertion seems to be very risky and concerning for babies and mothers alike. Exactly how often does this occur? Various sources say that it occurs 1% of the time. A Velamentous cord insertion is more commonly known within twin pregnancies. In the American Journal of Obstetrics and Gynecology, a Velamentous cord insertion was first described in the late 1700s, and the first cases of vesiprivia were reported in the 1800s. Fortunately, Carrie's pregnancy ended with great news. Our daughter, known as Twin A, during pregnancy was a very healthy baby considering the struggle she faced while in utero. She did have low birth weight, but those were about the only complication she had. Today, Zoe, formerly known as Baby A, is a healthy 4-year-old girl. By observing her or even comparing her health to her twin, Kara, you would never know that she had a velamentous cord insertion. Zoe is a normal 4-year-old who is vibrant and full of life.